Welcome to the second education session for lung transplant at UCSF. This session is focused on the information you'll need to know around the time of listing, while you're on the list, and also to start you thinking about the surgery, the hospital stay, and your recovery. Please watch this as many times as you like and share it with your friends and family. This information is mostly about the normal case scenarios, but know that lung transplant is not a simple undertaking, and your particular situation may be much different from this. Do not hesitate to contact your coordinator with any questions you may have. We'll be happy to address your concerns and questions. We'll start with the information you need for when your name is placed on the wait list. When our team has reviewed all of the testing and information about your case and finds you to be an acceptable candidate for transplant at UCSF, this is when we will consider listing. Your name is placed on the UNOS wait list, which is a national wait list, but indeed most of our donors come from Northern California. This is for logistical reasons. At the time you're listed, we start to receive donor offers on your behalf. So unless we receive updates from you, we will assume that you are in the same condition as you were when we last saw you. We field donor offers 24 hours a day and 7 days a week, so we must have your updated information in real time. We rely on you to keep us updated on any and all changes in your status. Changes in phone numbers or address should be reported right away, as it affects our ability to reach you when we've located the right donor for you. If we cannot reach you, it may jeopardize your chances for transplant. Clearly, if we cannot find you, we cannot transplant you. If your insurance changes, please notify us right away, as we want to try and make sure that you do not have unexpected financial issues while you should be focused on your recovery. It is especially important to report any changes in your health condition immediately. Even if you have not been to see the doctor yet, call our office to report new symptoms like runny nose, congestion, and fever right away. This will help us get the information to our call team as soon as possible. Ideally, we'd like you to call, report new symptoms, and then get to the doctor right away to get it checked out. You should not wait to go to the doctor, because if there's anything they can do to help shorten the illness, it will help us to get you back to active consideration for transplant. We cannot transplant you while you have an active infection, as there are already enough variables in transplant without starting off like that. After you've been to the doctor, then call our office back and let us know what their plan is and if they've started any new medications like antibiotics. We'll pass this along to the call team as well. You will then want to call and update us every couple of days or so on how you're doing, so that we know when you're getting back to your baseline. You need to report changes in your oxygen use, even if your use goes up by just 1 liter per minute. This lets us know that you're getting sicker, and it also gets entered to the lung allocation score and may move your name further up the waiting list. You will also want to report things to us that don't seem lung-related at all, like a broken toe or a mole you have removed at the doctor's office. The broken toe may affect your ability to get up out of bed and start your rehab, and we would want to see the pathology report from the mole to make sure that it was not a skin cancer. Do not rely on communication to get to us from your local doctor or hospital, as sometimes they get busy with other things. Call us yourself or have your family or friends call. We have established a 24-hour phone line, area code 415-353-4145, especially for listed patients to call and report updates. During business hours, this is answered by our office staff, but in the off hours, it's answered by our answering service. You will need to let the service know that you are a listed patient and that you need to get a message to the lung transplant doctor on call to report this issue. This ensures that your updates get to the right person quickly. There is a lot of choreography that goes on behind the scenes when lungs are allocated. It could happen that we call you in, find out you have new symptoms that you did not report, and then have to see if the lungs can be offered to the next person on the list. If there is limited time until the donor OR and all the other organ teams are already in transit, we may not be allowed more time to get another recipient into the hospital from home. If this happens, there's a chance that a perfectly good set of lungs could go into the trash, and no one wants that. If you cannot use them, the next person certainly could, and this resource is far too scarce to waste. If you do not call, you may jeopardize your chances for transplant. Next, from the time your name goes on to the list, you must be available via phone at all times. This includes days, nights, weekends, and holidays, as we get offers all the time, not just working hours. Your coordinator will request a list of phone numbers from you so that we can reach you all the time. If these change, don't forget to notify us. One of the worst scenarios we can think of is not being able to reach you when we get the right lungs and the offer passing you by. We just never know when or if the right offer will come again. Remember to keep your phone on, the ringer up, and keep it charged. You will need to get into the habit of answering all the calls that come in. During working hours, the call may come from our office, but the call may also come from a call service we use. Their coordinators are located all over the country, so it may come from an unfamiliar area code. You must answer all calls. When we do locate the right lungs for you, we will call all of the numbers you've given us, and we'll leave messages to call us back right away. When the donor lungs are offered from the organ bank, we have a limited amount of time to locate you, sometimes as little as an hour. This is not the time to get you into the hospital, but an hour to locate you, see how you're doing, and make a decision on accepting the offer on your behalf or not. If we are unable to find you quickly, there's a good chance that they will pass you by for the offer, then move on down the list to the next recipient. We don't want you to miss out on an offer, and we certainly don't want any lungs going to waste. Since we don't know how long it'll take to find the right lungs for you, let's talk about what you'll need to know for the time you're on the waiting list. In addition to calling us with any and all updates, which I cannot stress enough, you will also want to keep yourself in as good a condition as you can. Keep your weight appropriate. Don't gain too much or lose too much weight unless you have specifically been instructed by us to do so. Keep active. The better condition you're in when you go into transplant, the better you will do with your recovery. It's particularly important to keep your leg muscles strong so that you can get up out of bed soon after surgery and start moving around. This will help us minimize complications like blood clots. Stay away from sick people. When you're exposed to illnesses, you may develop them, and you really don't need an acute illness on top of the chronic lung issues you already have. When you develop an infection, we're unlikely to transplant you during that time. If we suppress your immune system when you have an infection, we take away your ability to fight off the germs, and it may get worse instead of getting better. Practice infection control. Wash your hands frequently and use alcohol gel if soap and water are not available. Use oxygen as prescribed. There is absolutely no advantage in you being stingy with your oxygen use. Unless you have been instructed otherwise by our doctors, we recommend that you keep your oxygen saturations above 90%. This means that you must monitor it periodically with a pulse oximeter, so it's good for you to get your own. It also means that you should use as much oxygen as it takes to maintain these saturations. You may need to speak with your doctors to get the prescription adjusted so that you have adequate tanks or equipment. Please do not be stingy with your oxygen use. It does your body absolutely no good in the tanks. While you are on the list, you will need to keep seeing your regular doctors as they are the ones who are actively treating you. We are only acting as a consult service. If you get sick, it will be your regular primary care doctor or your pulmonologist you go to for treatment. But don't forget to call us with an update. At the time of the transplant, we take over your care for a while and wean you back to your local doctors over time, except for the care of the lungs. But for now, you need them to continue care for you while you wait. It is also important to maintain a good relationship with them for your after-transplant care. A good local doctor can help manage some of the common side effects of the immunosuppressants, like hypertension, which is high blood pressure, or diabetes, which is high blood sugars. This will allow us to focus on the care of the lungs. During your wait on the list, we will want to see you back in clinic periodically to make sure that you're as good a candidate as you were when we saw you last. Typically, we see patients in clinic at least every 3 months, but we'll see you more often if you get sicker or if you have hospitalizations or illnesses. We will need to update some of your testing at least every 6 months to keep the lung allocation score up to date, like the breathing test, arterial blood gases, 6-minute walk test, and labs. We will need to get an updated CT scan of your chest at least every 6 months to screen for cancers. We will also need to get an updated echocardiogram at least every 6 months to make sure that the right side of the heart is holding up under the additional stress of the lung disease. We'll try to coordinate these tests for when you're coming to UCSF for a visit with our doctors. Around the time you go onto the list, you will start to receive a kit in the mail every month that contains empty tubes. These are to be taken to your local lab for blood draw and are due back in our lab by the time stated in the letter that comes with the tubes. This blood will be used to retest for antibodies against potential donors. We initially tested your blood for antibodies when you had blood drawn at UCSF, but this can change over time. This monthly kit is our way of making sure that we know what your current immune status is. It also may be used to test against possible donors if there's some question of your compatibility with them. If your local lab needs an order for a standing blood draw, please contact your coordinator to get this. While you are on the wait list, or even before that, it would be good to speak with someone who's already had a lung transplant. UCSF offers monthly support groups moderated by our social workers that you can attend to meet and discuss your concerns with post-transplant patients. We would truly encourage you to do this. We can also connect you with a post-transplant mentor to talk with one-on-one. Ask your social worker or nurse coordinator for more details about this. Very important to remember for while you're on the wait list. If you have an emergency, do not delay your care by calling our office to ask what you can do. If you need emergency care, dial 911 or go to your local emergency room right away. Do not delay. Once you are safely in care, call our office or have your family call to update us on where you are and what happened. Do not rely on the hospital or doctor's office to call us. You must call to notify us for 2 reasons. 1, so that we can update our call team and let them know your status as it relates to accepting donor offers for you. And 2, so that we can consider transferring you to UCSF for care. Once we get a message from you that you're at a local hospital, we will call and review your status with the doctors taking care of you. If it seems like they're on the right track and you're getting better, we'll likely just follow along via phone, see how you're doing every few days, and then see you in clinic after you've been released from the hospital. This would be the case with something like an infection where they're treating with IV antibiotics or a broken bone. But if it seems like you have an exacerbation or something going on where it might benefit you to be at UCSF, we will request that they transfer you to us and start making arrangements for that. I'm going to say this again as it's very important. Do not delay in seeking emergency care when and if you need it, but do remember to have someone update us as soon as you are safe by calling our 24-hour phone number. It is important to know that being listed for transplant is not a guarantee of actually getting a transplant. It certainly would be our intention, but sometimes things happen. If you develop a new medical issue, if you gain too much weight or lose too much weight, or if you become too debilitated, your name will be removed from the wait list. And there is such a thing as being too sick for transplant. This also applies to psychosocial reasons. For example, if your caregiver support plan, transportation, or insurance, or medical compliance and adherence become inadequate for the transplant process, your listing may be jeopardized. If this happens, the team will notify you of the issue and of your delisting.
Now, let's talk about actually getting the call to come in for transplant. Before we call you, our surgeon has already reviewed all of the donor's information and determined that it is indeed a good donor for you. This means that the donor's history, the imaging, like the CT scan or chest X-ray, the lung function, and all the blood testing has been reviewed. We have made sure that the lungs are approximately the right size and that they are a compatible blood type to yours. By the time we call you, we have usually already accepted the offer on your behalf. Because of this, and because of the arrangements for retrieving the lungs have already begun, it is essential that you be prepared to come at a moment's notice. We do not want to risk losing good lungs due to delays. To this end, you should start preparing your trip into San Francisco. Make sure that you have made arrangements in advance for someone to drive you in, and make sure that they can get to you right away, or you get to them when the call comes in. Again, no delays. When we call, we'll ask if you have any new symptoms. Hopefully, you will have called to report these in advance, but if you do have something new going on, please tell the coordinator when they call you. We will find out when you get to the hospital anyway, and you may just save yourself an unnecessary trip to San Francisco. If you have active signs of infection, this may not be the best time for transplant. We will tell you that we think we have the right lungs or lung for you. At this point, the offer has been thoroughly reviewed, and so far, everything looks good. However, at the time we call you in, the donor lungs have not come out of the donor's body yet. So, there is a chance that something may later turn up that tells us the donor lungs are not as good as we thought. If this happens, we will send you home without the lungs and call you when we have the next good offer. There's no sense in starting this already complicated process with lungs that are not good. When we call you, we will tell you to leave your valuables at home. Please take off any jewelry and leave it at home, even wedding rings. And any electronics you may bring, like cell phones or laptops, please make sure to give to your family for safekeeping while at the hospital. We typically tell you not to have anything more to eat or drink. This is to avoid aspiration into the new lungs while you are lying flat for the surgery. We will tell you to bring your medications or a list of your medications that includes the doses and times. If you have any medication that is difficult to walk into a pharmacy to get, please do bring this one with you, just in case you need a dose and we don't have it in stock. The hospital does have a rule that patients cannot have their own medications at the bedside. So, to avoid this issue, we will inventory the meds and then give them to your family or friends to keep safe. We will remind you to bring in your insurance card and a photo ID for getting you checked in at the admissions office. And importantly, you will need to bring enough oxygen to get to UCSF and enough to get home, just in case the lungs aren't good enough. You should prepare yourself for this possibility because it happens about 1 out of every 3 or 4 times we call someone in, so indeed, it could happen to you, and sometimes more than once. In terms of packing, you may want to start thinking about it in phases. 1. What do I need to grab quickly just to get to the hospital? This would be the things we just mentioned: insurance card, ID, meds, and lots of oxygen. You may also want to put a list of things to grab at the last second on your fridge so that you're not delayed further. Things like your phone charger and your phone contact list that you can't pack in advance but will want to bring. 2. What will I want when I wake up after surgery and am starting to move around? For the first few days after you wake up, you won't be very alert to these things, but after 3 or 4 days, you may want to have your own toothbrush, your own brand of toothpaste, your own robe, or your own slippers. We do have everything you need at the hospital, but if your own personal care items make you feel better, you can have someone bring things like this while you are working on your recovery. You will not need to bring clothes at this point because we will want you to stay in hospital gowns until almost time for discharge. 3. What will I need when I'm discharged from the hospital and moving to my San Francisco home? You definitely need a thermometer, a blood pressure cuff that measures heart rate too, and a scale to weigh yourself. We will have you take your own vital signs a couple times per day to monitor yourself for signs of rejection or infection. You may want to start thinking about what kinds of clothes to pack. We recommend that you pack shirts that button or zip in the front because you will have restrictions on raising your arms above your head while you recover. Women may want to think about getting comfortable sports bras that close in the front, not that you pull over your head. Plan to bring comfortable pants and walking shoes because you'll need them to get out and use those nice new lungs. You may also want to consider bringing a wedge for your bed so that your head always stays higher than your stomach while you sleep. This is to avoid aspiration into the new lungs. When we call you in, we will tell you to check in at the admissions office on the first floor of the main hospital at 505 Parnassus Avenue. We will have called ahead to let them know why you are coming and request that they start getting a room ready for you. When you are admitted urgently like this, it's hard to tell where you will be roomed, but as soon as you are checked in, the admissions staff will send you to your room and we will find you there to get started with this process. Surgery usually happens within 12 hours of when you are called in. However, there may be unexpected delays. We will do our best to keep you informed of these. After you're in the room, the nurse will start an IV, get some blood drawn, and get you settled in. Doctors and other staff will come to interview you and get the surgical consent signed. Then we wait. You may want to bring something to keep your mind busy while you wait, like a crossword puzzle or a book. We needed to get you in and checked out as quickly as possible so that we can then focus our attention on the donor surgery and preparations. There are so many arrangements involved in getting the organ recovery planned. This period of time is usually about getting recovery teams that may be coming from several different facilities to retrieve the liver, kidneys, heart, etc., all to the donor hospital. So, there may be delays in your surgery that are due to some of these logistics and have nothing to do with you or the donor's quality. There are some situations that may add complication to the call-in and surgery waiting period. For high-risk donors, we will normally call you to discuss the high-risk donor classification even before we accept the offer on your behalf. Please see our video clip on high-risk donors as they deserve further explanation. A DCD, or deceased by cardiac death donor, may also add some complexity to the transplant surgery. This is a situation where the donor's heart stops after life support has been withdrawn as dictated by the donor's family. The surgery then begins for organ donation. In this situation, if there is an extended period of time after support is withdrawn and before the heart stops, the organs may not be useful. In this situation, you would be told there is an increased likelihood that you would be sent home without transplant. There is a possibility for you to be called in as a backup recipient for a donor offer. This means that we have accepted the lungs for a person above you on the wait list, but there is some issue about that match that may not work out. I can think of 2 instances when we do this and neither comes up often. The first would be when the intended recipient has some antibodies that may be problematic with that specific donor. Cross-match testing takes several hours, and we may not have the time to complete the testing before we call in that recipient. We may also not have time to call in another recipient after the cross-match is completed for reasons of the donor OR timing and our recipient's travel time to UCSF. In this case, we need to get both the first and backup recipient to the hospital while the testing is in progress. If the cross-match testing looks good, the lungs will go to the intended recipient. But if the testing indicates that the recipient's immune system would attack the lungs, we would give the lungs to the backup recipient. Another reason we may call in a backup recipient is if the intended recipient has pulmonary nodules that we think are benign based on imaging. We tell these recipients that when they are called in for transplant, the nodule will be taken out in the operating room and sent to the lab for examination under the microscope. If the nodule turns out to be cancer, the incision is closed up and that patient does not receive the transplant. At this point, we have to have the backup recipient ready to go to the operating room right away, or else the lungs, which are usually on their way back from the donor hospital by now, will have longer ischemic times. We will let you know if you are being called in as a backup recipient. Again, because of timing, we cannot wait to get you on the road to the hospital until we have all the information back. If you are called in as a backup recipient and the lungs go to the primary recipient, we will send you home and try again when we have the next good offer for you. As a reminder, we can transplant either a single lung or bilateral lungs, meaning both. You should be prepared to be called in for either one or 2 lungs unless we have specifically told you otherwise. And of course, if you need a combined heart and lungs, we will have already discussed this too. Here are some reminders about the surgery and your hospital stay. The anticipated length of lung transplant surgery is about 8 to 10 hours barring complications. The average hospital stay is about 2 weeks. Approximately, the first week is spent in the intensive care unit, and the second will be on the medical or step-down, less monitored floor. When you wake up in the ICU, you will have a lot of equipment attached that you did not have when you went to sleep. You will have the breathing tube in your mouth connected to the ventilator by tubing. We wake everyone up like this so that we can take some measurements of how well the lungs are working before we take the tube out. It's good for you to know this in advance so that you don't fret that something went wrong when you wake up after the surgery and are all confused by the drugs. The tube typically comes out within a day or so after surgery. Of course, if there are issues, we may need to leave it in longer to be safe. Because it's normal to wake up, see or feel the tube in your mouth, and reach to take it out, we will have your hands tied down with soft restraints so that you don't accidentally pull out the tube. These will come off when the tube comes out or when we're sure that you are fully oriented. You will have the incision across your chest for 2 lungs or around your side for 1, which will be covered by a superficial dressing to catch drainage for the first day or so. The outside of the incision is normally closed with surgical glue, and on the inside there will be stitches which dissolve over time. If the surgeon had to cut across the sternum or breastbone to get far enough into the chest to implant the lungs, you will have a wire inside to stabilize the bone and cartilage while it heals. This wire will remain inside even after you have healed. You will have 2, 3, or 4 chest tubes below the incision line. These are tubes about the size of my finger. They are used to get drainage out to the bedside containers to minimize the risk of a pocket for infection. These come out once the drainage has slowed or stopped. You will have a catheter in your bladder to collect urine and a catheter in your back to help with pain management. These will come out once you have been transitioned to oral medications. For patients with scleroderma or other esophageal issues, you may need a temporary or permanent feeding tube placed in order to minimize your risk for soiling the new lungs. You will want to prepare your family for seeing you with all the equipment around when they first see you after surgery. Because of all the fluids you are given during surgery, and perhaps because of the position you are in on the operating table, your face, your hands, and arms may appear quite swollen to your family and friends. This is only temporary. The fluid will be reabsorbed when you get up and move around. We will be getting you up from bed very shortly after the surgery, and at the time you may consider it just plain meanness on our part, but we're really trying to minimize your complications. So be prepared to get out of bed and work really hard on your rehabilitation right from the start. As the equipment gets less and less, you will be getting more mobile. So be prepared to get walking. A few more reminders. Because of the very high dose steroids that we use to knock down your immune system right from the time of the surgery, and because of sleep deprivation from all the bells and beeping, you may have some changes in your emotions. You may feel more fragile than usual, maybe angry, perhaps paranoid, anxious, or depressed. You may also experience some hallucinations. It's important that you and your family know that these issues are only temporary and will resolve as the doses of the steroids go down and you get more sleep. During the second week after you've been moved out of the ICU to the floor is when we start with teaching you and your caregivers more about these new lungs. Our nurse practitioners, coordinators, and pharmacists will arrange for times to meet with you and your support team to learn about your medications and how to care for yourself after transplant. Please give your support team advance notice that they will need to be at the hospital for these teaching sessions, and we would very much appreciate their flexibility in scheduling when the time comes. We will ask that they review information in advance and come prepared to discuss their questions and concerns. You will need to stay within a half hour of UCSF with your care person 24 hours a day and 7 days a week for the first 6 weeks starting at hospital discharge, not starting at the date of surgery. You will want to start making at least some tentative plans for where you will stay for your local recovery even before you go on to the wait list. This may involve visiting local hotels to see what their accommodations look like, and it will usually involve raising or saving some funds in order to pay for it. Be prepared to work hard, follow instructions, and ask questions when something doesn't seem quite right. We're counting on you to do your part, and we'll be here to help you by doing ours. Thank you for watching this phase of education about lung transplant at UCSF. We hope that this information is clear and helpful. Please watch it again and share it with your friends and family so that they also have some understanding of how complicated this process and recovery will be for you. If you have questions, please contact your coordinator so that we can help clarify any concerns you may have.